Hey, good evening, everybody. Hello, hello, hello.
Hello, good evening. Happy Sunday.
Happy Sunday. Hey, Dr. Kadisha.
Hey, Dr. Carol, Dr. Dietrich. Hi, everybody.
Hi, good evening,
Hi.
Facebook. Yes, hello. Good evening. It's Dr. Dietrich Gorman, also known as America's Relaxation Doctor, here with my wonderful, beautiful colleagues, Dr. Khadijah Rapp, your Emergency Medicine Mobile MD, and Dr. Carol Penn, your Master Movement, Meditation, and Mindset Guru. Tonight, we're here to bring you another perspective in primary care live broadcast. Please share or host a party, and of course, if you're watching the replay, hit replay in the comments. Okay. Tonight, we're going to be actually talking about venous thromboembolism or VTE or blood clots. But let's see if anybody is going to be coming in. So, Dr. Khadijah, you can see that, right?
Yeah, we've got
Excellent.
about two people right now.
Okay, good, good,
Yeah,
good.
please post
Okay.
something in the comments. Post something in the comments if to let us know you're here.
Yes. Excellent. And so I guess I'm gonna just go ahead and keep on going. And we actually, Facebook folks out there, we actually decided to on this topic from a viewer request, right? So you see, we do listen to y'all. Just give us some topics that y'all want us to discuss, and we'll pick from those. And by the way, our last episode was actually very good. It was the elderly. Managing the expectations of the elderly and their families. So it was a great live stream. Please check it out and be sure to hit replay, right? So again, thank you very much for joining us. Tonight we're going to be discussing VTE or venous thromboembolisms. Okay, I see Kasali is in here too. Thank you so much for joining us. All right. So I'm going to start the show off by talking statistics. And what is a VTE? What is a blood clot? How they form? What are the risk factors? Okay. Then we're going to talk about what happens when you happen to go to the ER and if there's a suspicion for a blood clot or a PE, pulmonary embolism. We'll talk about that. What are your presenting symptoms? What's the workup that's going to go on when you're getting diagnosed with venous thromboembolism? And then we're going to talk about when you're actually admitted to the hospital, what's the treatment course, what to expect. All right. And then what happens in that whole situation. And then we're going to bring it on home that afterwards, what is your expected course? What's the follow up? All right. You're going to have a lot of information tonight. It's going to be great information. So please tag people, share this live, host a party, do all that stuff to get people on in here. All right. But just finally, a very small disclaimer. Even though we're all board certified physicians, we're here to educate you all. So please keep that in mind. We're here to give you some understanding of what this topic entails. And I know some people hear about things that they don't understand it when they're at their doctor's office or whenever they're there. And for whatever reason, they may not feel comfortable asking all the questions. So that's why we're here. Okay, we're here to educate. But having said that, we're not here to treat or take the place of your doctor. Okay, so please keep that in mind. All right. Y'all want to say anything else about that? Are we good to go?
I
We are
think we're
good.
good. I think we're good. That's clear.
Okay. Okay. I see Marlene Reeves is here. Thank you so much for joining us. Okay, good. So I'm just going to start it off by sharing some stats. So these may be something y'all know or don't know. I was kind of shocked to hear some of the things. I got my information from the CDC and the American Heart Association. All right. So, venous thromboembolism is the third leading vascular diagnosis behind, y'all want to guess?
Heart disease.
Heart attack is one,
Mm-hmm.
and the other
Stroke.
one, yes, exactly, the stroke. So it's the third leading vascular diagnosis between those two. It affects actually 300,000 to 600,000 Americans each year. That's from the American Heart Association, but from the CDC, it shows as much as 900,000 can be affected in the U.S. So that's a lot of folks. And actually, 60,000 to 100,000 Americans die each year from a VTE. So it's definitely out there. And then sudden death is actually the first symptom in about 1/4 of the people who have a pulmonary embolism. And I'll define what that is in a minute. 1/3 of people with a DVT, deep vein thrombosis, or a pulmonary embolism will have a recurrence in 10 years. So that's pretty shocking as well. All right. So I see a couple more people are joining us, and thank y'all so much for joining us. So I'm going to actually start off by saying first, let me tell you what a VTE is, or what is a venous thromboembolism or a blood clot. But I'm going to break it down for you. Venous means the vein, right? Thrombus means clot. An embolism is like the lodging of material or like a blockage. It's like causing a piece of a material. All right. So if it's a blood clot, it's in the vein. If it's like an air or gas, it's called a gas embolism. So you get it. An embolism is that blockage. So we have a venous thromboembolism, a blood clot in the vein. All right. So that breaks that whole word down, that big term down. So it won't be so scary if y'all hear it. Right. There's actually two types of venous thrombosis. The first one is a deep venous thrombosis, and that's a clot that lies deep in the leg. But sometimes it can occur in the arm or in other veins, but more commonly we see it in the leg. And then you have a pulmonary PE. So a DVT is a deep vein thrombosis usually in the leg. A PE is a pulmonary embolism. And this actually occurs when a DVT or a clot breaks from the vein, travels up into the lungs, and then blocks blood supply there. Now, this can be partially occluded or partially blocked, or it can be totally blocked, or what's called a total occlusion. So, what is the cause, or what predisposes a person to having a venous thromboembolism? So, there can be damage to the inside of the lining of the blood vessels, and this is called endothelia. All our blood vessels are lined with a very small layer of these endothelial cells. And so when they are damaged, what's called tissue factor, is exposed to the bloodstream, which now initiates our own clotting cascade to come to that area, try and repair it, but then it kind of goes into overdrive, and then that's how a clot forms. Another way is the blood flow is abnormal. So, for example, people you may have, or people who have bad varicose veins, people who are immobile, like someone who's sitting for a long period of time after someone has had surgery, long trips, that kind of thing. Even a person who has atrial fibrillation, and that's basically a heart condition in which, like, the atria of the heart aren't beating smoothly in sync with the ventricles of the heart, and so that blood just kind of sits there. And so when you have abnormal blood flow, that blood just pools there, or it's basically stagnant. It's not moving. Okay, so that's how a clot can form. And then you can have what's being in a state called hypercoagulable. And this is when you actually have the tendency to clot. So there's what's called a biochemical imbalance in your body between these circulating factors that can cause that. So who has this, right? People who are on birth control pills, people who are on like hormone replacement therapy, being pregnant, being obese or overweight, smokers, or even a genetic component to it. All right, and this is called an inherited thrombophilia. Needless to say, there's many risk factors. Okay, but in summary, age, surgery, obesity, cancer, pregnancy, hormone contraception, hormone replacement, genetics, immobilization, people who are paralyzed because they're just laying there, long travel distances where you're not getting up and walking around. You've heard of that. Smoking, being hospitalized, like I said, genetics, all those things, are kind of setting you up for that. So, but you may be asking yourself, all right, Dr. Dietrich, I have a lot of that stuff. I'm heavy. I smoke. I don't go nowhere. How do I know if I have a blood clot, right? So there's definitely some symptoms that I want you to be aware of. And I'm going to stop talking right now and have Dr. Kadisha chime on in, and she'll talk about some symptoms and what the workup is if you should happen to present to the ER with concern for a clot. Dr. Kadisha, what
Thanks
do you
a lot.
think?
Thanks a lot, Dr. Dietrich. So symptoms that bring people to the ER, they tend to be like a pretty common handful of symptoms, but you might be wondering, like, how long would it take for me to develop symptoms after I have a DVT or a PE? Well, honestly, it depends on how much of your leg is involved, like, or basically how large the clot is, how large the clot is in your leg, how large the clot is in your lungs. It also depends on how much of your lung is actually involved, and whether or not you have underlying heart or lung disease. I know of an athlete who had taken a transatlantic flight, but and he developed a PE. He was in great health. He didn't smoke. He was lean, but because of the prolonged immobility of that flight, he developed a PE. But he did not have a lot of symptoms or severe symptoms because he had his lungs were in great shape, or he was in physical great physical condition. So it depends on how much reserve you have as far as the amount of lung tissue or the health status of the lung tissue. But so common symptoms that bring people to the ER. Number one is shortness of breath. It tends to come on suddenly and it gets worse with exertion. People will say, I can normally walk up the stairs of my house, no problem, but I had to stop halfway. Chest pain, and it could be any kind of chest pain. So don't discount it because it's not a particular kind of chest pain. Typically we say the chest pain is sharp and it increases with breathing. It hurts to breathe. We call that pleuritic chest pain, but it might present as heavy or tight, like it might with an anxiety attack or a heart attack. And it often can be felt if you start to cough, or if you bend, or if you have to stoop for some reason. Typically, again, like with the shortness of breath, exertion will bring it on. And then you might have a cough. You may feel, you may produce bloody or just blood streaked sputum. Your mucus may have just a thin stripes of blood in it, which may be unusual to you. There are other symptoms also that make PEs very tricky. You might just feel like dizzy. You might feel dizzy, or you might be extra sweaty while doing your typical daily activities. You may feel clammy, or you notice that you're pale, or a loved one notices that you are pale. So shortness of breath, chest pain, cough, often bloody sputum, not always. It could even be a dry cough, or you might just feel dizzy, lightheaded. You feel like your heart is racing or skipping beats, or you just have a clammy feeling about you, or when it's really severe, you might have a sense of impending doom, like you do with an anxiety attack. So that's with the PE. The DVT, the deep venous thrombosis that Dr. Dietrich referred to before, that's often the precursor, or that's the first thing that happens before the PE happens. And with that, you may have leg pain or swelling, and usually it's just one leg that is swollen, painful, typically in the calf area. There might be some redness there as well, but pain, swelling, redness, especially compared to the other leg, that's commonly seen with DVT. And so you come in, you tell us these symptoms, and then we have to go through like what those risk factors are that Dr. Dietrich mentioned, because those will also tell us your level of risk for having a PE. So I know I put in the previews how different celebrities had PEs, a couple who have died. So Frida Kahlo, for instance, the legendary Mexican artist, had been ill the year before her death, and she was only 46 years old. And mind you, I'm going to tell you, the two people who I cover who died were only in their 40s. So she had been ill. She had her right leg amputated at the knee due to gangrene, due to another condition, and she had pneumonia, which had left her kind of frail. So she likely was not moving around very much, especially with one leg. And then she had the history of lung disease, which made her more vulnerable, gave her less reserve, if to sustain a blood clot. She died like a week um, after her 47th birthday, actually.
Wow.
So she was immobile. She had lung disease and probably some other underlying disease, which had led to her leg amputation. So that's why, unfortunately, um, she likely developed the PE. So other historical things that are pertinent. So we're going to ask you, so have you been immobile? Do you have medical problems? Do you have certain conditions? Are you pregnant? Any chance of pregnancy? Serena Williams suffered her second bout of PEs shortly after her pregnancy, after giving birth in early 2018. In 2011, she had her first bout of PEs. She had been wearing a brace for a while. She had cut her foot or her leg previously and had been doing a lot of flying. The last flight she took before those symptoms of shortness of breath and chest pain and coughing set in for her, her last flight was from New York to Los Angeles. She was going to see doctors about her leg injury and had been wearing a boot. And let's see, and so that's the flight that they are, attributing her PE to. So she was treated that time, she did well, but then she became pregnant. And like Dr. Dietrich said, that creates a hypercoagulable state because your levels of estrogen are high. So people with high levels of estrogen, be it pregnancy or birth control use, that estrogen puts you at risk for a blood clot. And luckily, she knew during that first week after giving birth of what her shortness of breath and cough and just not feeling right meant. She knew what that meant, and she was able to tell the hospital staff that she believes she needs to be evaluated for a PE, pulmonary embolism. The staff did not believe her, and that delayed her care somewhat. But luckily, because she was an athlete, she survived their delay in care. They found it, and she was anticoagulated again. And she's still here with us today with her child. So we've gotten pregnancy, hypercoagulable state; birth control pills, hypercoagulable state; flying, long flights, long road trips; having a brace on your leg; any kind of immobility, be it having one leg amputated or being in a brace. Those things can put you at risk. Those are things that we're going to ask you about. And when you ask us, Doc, why do you think I've got a blood clot? I don't think I have that. It's just a cough. I'm sure it isn't. No, I'm going to tell you it's because of this, because of that, because you're 35 years old and you're smoking on birth control pills, or because you took the long flight, or the car trip, you have a history of cancer, things like that. So what we do is, after our physical exam, and your physical exam, like I said, the leg's going to be swollen, typically swollen, a little red, warm. You'll think that it's an infection, that it's like a staph infection, cellulitis. For those who know, typical skin infection that causes redness, swelling, warmth, and pain. That'll be in our list of possibilities, but we still have to rule out a blood clot in the leg. So your lungs might sound totally clear. They might not give us any clue at all. But then you'll say, but my lungs are clear. Yes, but you said you're having shortness of breath, dizziness, sweating, chest pain with, breathing in and out, cough. we're still keeping those things in the consideration. And I'm saying all this because I've had debates with patients throughout the workup for a PE. They didn't
Mhm.
believe me the whole time. so,
Right.
so we do the exam. We get blood work. One of them is a D dimer. We'll have to explain that to you, but typically it's elevated. And yes, it could be elevated in multiple other conditions, be it cancer, arthritis, stress, maybe other things. And if it's high, that raises the red flag to get imaging of your chest. Now, I know you say, well, you'll just get a chest x-ray, right? Back in the day, decades ago, they used to tell us about the signs that you would find on a chest x-ray that were indicative of a pulmonary embolism, but people don't even get the chest x-rays anymore unless they have no CAT scan. We're going to get a CAT scan of your chest, and we really need to get the contrast dye. So if so ask yourself, do I have an issue with iodine? Do I have an issue with shellfish? Because usually there's iodine in, shrimp, crab, lobster, things like that. We're going to need to get a CAT scan with that IV dye to rule out the blood clot. So that will be our the evaluation portion. So but say you can't get the iodine, well, then we'll have to go to another imaging modality or type of imaging called a ventilation perfusion scan, and that's a nuclear medicine exam. And typically, you're not going to be able to get that on the same day. So don't get mad at us if we say, hey, yeah, I don't know if you have a PE or not, but because I'm suspicious, we're going to have to admit you and you get that test done tomorrow. It's worth being admitted because of how life-threatening this can be. So yeah, if you can't take the iodine dye, then you'll hear the term VQ scan, which is ventilation perfusion scan. But if we get the CAT scan, we find the blood clot, we're going to have to give you blood thinners. Dr. Dietrich will go more into blood thinners, but we have to start those things in the ER. And then you will need admission.
Right. Thank you. Thank you. Oh, I think one of the things, I don't know if you talked about like getting a lower extremity Doppler to
Oh,
see if
right,
there's
for the DVT. Yes,
yeah.
Dr. Dietrich. So to rule out the DVT, it's just the Doppler is an ultrasound. It's the same machine that is used when you're pregnant. They put gel on your leg and then they run the one up and down your calf area, typically like the back or the sides, to see if you have a blood clot there. If we find a blood clot there, then we know you have a pulmonary embolus. But we still need to get that CAT scan. Even if we see the clot in the leg, we still have to get the CAT scan. So please understand that. If we don't find a blood clot in your leg, we will still have to do the CAT scan. If you're having any of those symptoms, we're still going to have to do the CAT scan. So just work with us on that.
Right. Exactly. Thank you very much. Very good. And I'm just going to go over treatment. So now you're in the ER. You're admitted to the hospital. We will get that. They'll get that VQ scan. If needed. If you don't have the definitive diagnosis, but I'm going to talk about when for sure we do have this diagnosis. And so the mainstay of treatment actually for both a DVT and a PE is to actually prevent the clot from getting bigger. Okay. In the case of a DVT, we want to prevent it from getting bigger and to prevent the clot from breaking loose and going to the lungs to cause the PE. Because sometimes we might admit you if you just have the DVT only, not the DVT and the PE, but just to get things going with the DVT. So we don't want that clot to break off and then travel further and then really cause problems. Then after that, then the goal is to reduce the chances of having a DVT occur again. Whereas in the PE or the pulmonary embolism, of course, not only do you of course, you want to just stop the clot in the lungs from getting bigger, but you want to prevent new clots from forming as well, because this can lead to death. All right. I'm not going to talk about specific names of medications, rather just what they do and how we can treat it. Okay, because we don't have any financial ties to any of these pharmaceutical companies or none of that stuff.
Mhm.
So what are the types? You might be placed on a blood thinner. Okay, what are the types of blood, air quotes, thinners? Um, there are two types of blood thinners. They're actually antiplatelets and anticoagulants. And actually, contrary to their name, blood thinners don't really actually kind of thin the blood. They just they're types. They work with the different mechanisms in your body to prevent platelets from aggregating. So you have antiplatelets. The platelets are in your blood to help like form a scab or form a scar, that kind of thing. And so they stick together to do that. So you have antiplatelets. Then you have anticoagulants. They actually lower your blood's ability to clot by stopping specific proteins, and enzymes known as the clotting factors from doing their job. And we don't want any more clot to form. So that's what anticoagulants do. All right. So there may be other treatments. You may be given oxygen, okay, to help exchange oxygen in the lungs. IV will more than likely be started. Labs are going to be drawn. You're definitely going to be monitored. You may be hooked up to a heart monitor just to see if there's going to be any changes that are there. Additional treatments, if it's severe, very, very severe, and you meet certain criteria, you actually may be injected by what's called a thrombolytic. But again, the person who gets this thrombolytic, it's usually under dire circumstances because there's a very high risk of loss of life. And this is typically in the ER setting because there's a time frame that's there and it's a specific checklist that must be met before you get that. So that's probably not going to even be addressed on the floor. You probably would have already gotten it before you got to the floor. But then another treatment is what's called a filter. Yes, a filter, filter. And this may be placed in, or this will be placed in a very large vein called the inferior vena cava. And this is for people who can't have the anticoagulant treatment, but this filter catches the blood before it can reach the heart, right?
Right. Oh, and Dr. Deidre, can I just
Uh,
mention there?
uh-huh.
So Serena ended up getting an inferior vena cava filter
Uh-huh.
to help catch blood clots before they reached her heart and lungs because when she gave birth, actually she had an emergency C-section.
Uh-huh.
So when they started to anticoagulate her on finding the pulmonary embolus, she started to bleed from her site, the site where they had done the incision for the C-section. So they had to stop the anticoagulants, and put in that IVC filter for her.
Mm-hmm. Yep. So I've even had patients who had like a clot. They were on anticoagulation. They developed another clot while they were on anticoagulation. So that's really scary. And so then they had to be rushed to go get a filter. So that could definitely happen too. We just don't want that clot to keep traveling. All right.
Right.
Um, you may also have to undergo surgery, what is called an embolectomy. In which the surgeon will actually go in and try and remove the embolus. But this is considered a major operation and it has big risk with this. Okay. So this is considered if a person has a massive pulmonary embolism. So it's really kind of the end of the road. It's live or die right now, so that's when that would be performed. All right. So after a person is deemed stable, okay, you won't likely stay in the hospital the whole time until the clots are dissolved. But of course, that's going to be at the discretion of your admitting physician. But once you're stable, the medications are on board, you're doing good. They can't detect anything that's worsening. You're probably going to be discharged. So don't think like, oh, it has to be completely eradicated. You have to have multiple CT scans and all that stuff done to make sure it's 100% gone before you go home. That's why you're on medication. That's why you're going to be monitored, and you'll just do what you're supposed to do with your discharge orders. And when you go home, that's when Dr. Carroll is going to let us know what's going to happen after your discharge, what the recovery course is, what your follow up is. She's going to take us on home.
All right,
Literally.
we're home. We are home. So you've received excellent medical care. And as you've heard from my
Yes.
colleagues, Dr.
Yes.
Khadijah and Dr. Dietrich, it's, you know, it's multi layers of care, right? You've seen
Absolutely.
several medical specialists, different recommendations have been made, and you can see this is something that's very serious. And most often there will be a period of hospitalization. That being said, what are some of the big questions that patients leave the hospital with, or they ask, you know, after all the treatment has been done and anticoagulation and or a procedure has been decided upon? So if you've been given anticoagulants, which is very, very common, big question, how long will I need treatment with an anticoagulant? That's a huge, huge question, because people are thinking, am I going to have to be on this medication forever?
Right.
You know, oh my goodness, you know, and depending upon which one it is and the reasons, as you'll learn, the answer is different. So the duration of time you will need to take an anticoagulant depends on a number of factors that you should ask your doctor to review with you. This is an important thing. In the hospital, you're going to get your discharge papers, read them, and then ask the discharging professional, medical health professional, these questions. So you want to leave the hospital with some sense of how long you will need to be treated with an anticoagulant. Believe it or not, sometimes that question isn't answered or adequately addressed, or the patient's never asked it. And then they come to me in primary care, and I'm like, well, how long have you been on this anticoagulant? Well, I don't know. I was putting in, they think back, and it's like, whoa, it could have been stopped long ago. In some cases, years ago. B, it could have been changed to one of the newer anticoagulants. Yes, I've had a patient that was put on anticoagulant, didn't do any of the recommended follow-up, didn't go to a primary care doctor for over 2 years, only to find out they were a person who could have been off anticoagulation in 3 months.
Wow.
Yep.
3 months.
I've had that for sure. Yep.
So
It's
like,
surprising what
okay,
people will be compliant with.
Yep.
Yes. Yes. So, you know, and the person was like, nobody told me. And I was like, well, weren't you concerned, you know, about the events that happened? Yeah, I've been really worried, but I didn't know what to ask. Now that part was legit. Some people you don't know. So I want everybody, you know, whatever you record with, and if you are a medical person, I want you to be sensitive and be mindful that a lot of patients, they just don't know how to ask. So if you're discharging and you're a hospitalist, you want to make sure the patients, not just on the discharge papers, because I can't tell you, and I bet Dr. Khadijah and Dr. Dietrich could concur, people don't read this packet of papers.
That's exactly what I was gonna say. Read it. I mean, of course, ask, but read it too. We as healthcare professionals tell, and then you also take some responsibility too and read it. Oh, it's in my packet. It's in the car.
Yes!
I've had patients bring the folder in, and I'm glad they at least brought the folder in with the discharge instructions in it. And I end up reading them their own discharge instructions, because some of them will be discharged from the hospital like just within a week. They might come back a few days later saying, well, I don't know what to do. They didn't tell me anything. And it's just like, they really didn't tell you anything. Well, they gave me this. And it's like, so I'm reading through and I'm like, okay, well, Dr. Smith says follow up with him, in 3 days, call this phone number. And they printed out the prescriptions. Unfortunately, the prescriptions blend in with the papers, but there are prescriptions in here. Yeah. Oh, okay.
Yeah. Yeah.
So it's important. Communication
Yes,
is one of our colleague said tonight, it's all about the feedback, all about the feedback. So, so here are a couple of things. And if you are a patient, a client, watching tonight and listening, you want to understand these factors. What determines length of anticoagulation, or you might say the word treatment for your blood clot? So one, where was the clot? Location of the clot is going to determine the overall length of treatment. Two, risk factors which may have contributed to the clot. Now you heard Dr. Kadisha and Dr. Dietrich talk about some of those risk factors. From were you taking a long flight and sitting for a very long time? Do you have cancer? Do you have diabetes? Do you have any of those things that make you hypercoagulable? Are you pregnant? All of that. Risk factors for developing a future clot. So that's number 3. So, could you develop future clots? And what are those risk factors for you? Number 4, how well anticoagulation has been tolerated. So if you were in the hospital, you might have been treated with 2 or even 3 kinds of anticoagulation. And this is something that would be documented in your hospital paperwork. How well did you tolerate? We chose this, but then we went to B, but then we went to C for these reasons. Oh, the anticoagulation wasn't well tolerated, so a filter was placed. This is what Dr. Dietrich was sharing with you, and this is what you need to understand. And then finally, personal preferences and lifestyle considerations. So, what are your personal
Yep.
preferences and lifestyle considerations? That's very important. And the thing that we don't want to have happen is that because you have a particular personal preference, and if that preference is missed or not addressed, you therefore don't get the treatment that you need. A lot of patients do that too, and we're like, well, why aren't you being treated for this condition? And it's like, well, doc, I didn't want to do that. I didn't like the way the medication made me feel. You've got to speak up. You have to let us know. The only way we can address that is if you communicate with us. The worst thing to do is just stop taking a medication and not tell your healthcare professional, or not to start a treatment because you're reluctant about something. Ask the question. Please ask the question. And then Dr. Dietrich talked a little bit about which anticoagulant you will receive, but that can also be a question that you ask, because that's going to help you find out what your preferences are, what goes along best with your lifestyle. Another bullet point I want to address tonight, and another very common question, is when will my clot and my pain go away? A lot of times, depending upon where your clot is, there will be soreness, discomfort. You'll know something is wrong. So the body naturally absorbs the clot over the course of several weeks to months. The symptoms which accompanied the blood clot gradually improve and often eventually disappear. Symptoms typically improve within a few days of starting the anticoagulant. Most patients with DVT or PE, pulmonary embolism, or deep vein thrombosis recover completely within several weeks to months without significant complications or long-term effects. And that's the good news. Our body has natural mechanisms to break down and absorb the clot. However, there are some patients that will have this thrombosis syndrome, where swelling and tenderness will remain. And so what you want to do in that case is you want to find out what are some of the things that can help you. And you might be asking, well, why is this? My uncle had a blood clot and his went away, and didn't feel anything, and he was fine afterwards. Well, sometimes for people who have what we call post-thrombotic syndrome, this can be attributed to the damage that was done when the clot formed, and partly to the chronic obstruction from leftover clot or scar tissue. So it's not the clot, it's the scar tissue that's
The
left behind.
aftermath. Yeah.
Yes,
Mhm.
that can often cause pain, tenderness, swelling. So, one of the things that's common for this is graduated compression stockings. And they can
Yeah.
make, let's say if it's in your leg, they can make your leg feel better. They even have a sleeve for if it's in the arm as well. And this gradual tightness, kind of you feel it if it's in your leg, starts up your ankle, and then, very tight there, and then it goes up the leg, and this often relieves a lot of the pain, the tenderness, the soreness,
Welling.
and as well as reduces the swelling. And these are prescription. This is not something, that you should be ordering yourself over the internet. This is not something that you can, kind of off the shelf in a department store. It is prescription. It's 30 to 40 millimeters in pressure, and the stockings should be individually fitted. So it's not one size fits all. So different size, shape, bone structure, all of that is taken into consideration. So it's part of a professional medical evaluation. So that's where you want to have your relationship with the medical professional that is taking care of you after you've been discharged and you're now home. All right. So, and about 2 to 4% of patients with a pulmonary embolism, that's when the clot occurs in your lungs, will have chronic damage to the lungs known as pulmonary hypertension or chronic thromboembolic pulmonary hypertension. Ooh, that's a mouthful.
Yeah.
And this is often characterized by shortness of breath and decreased exercise ability. So again, this is serious. You want this to be evaluated by a practicing medical professional who takes care of this area of your health. So very important. If you have if you've had a clot anywhere and you notice that in your recovery process, you've got shortness of breath, you have reduced exercise tolerance, that's a call to your healthcare provider right away. That's
Right.
not to wait. That's not to mess around. And it could be, a part of your recovery process, and you might be in that 2 to 4% of people that are just going to have this chronic response. And again, there's some medications and treatments that you will be guided to that can reduce that symptomology for you. So that's very important. Then here's another question that's very common. How soon can I be physically active? So you've gotten through all of the above, and you want to be physically active. So many patients worry that being physically active might cause a DVT to break off and become a PE, pulmonary embolism, going to the lungs. The risk of clot breaking off and forming a PE is mostly present in the first few days and up to 4 weeks, while the clot is still fresh, fragile, and not scarred. It is actually the scarring that causes it to heal and make it less of a risk for breaking off and traveling. Although we just heard that the scarring can also cause some lingering pain. However, patients who carry out normal daily activities after a clot are no more likely to develop pulmonary embolism than those who don't walk around. Thus, being physically active after a clot is generally fine and is typically
Mhm.
encouraged. So important to have a good level of activity. Again, though, you also don't want it to be too much. You don't want to overdo it. And then again, this is where a good communication, a conversation with your healthcare practitioner is so important and very helpful. Here's another common question. Is it normal to feel anxious or depressed after a clot?
Yeah.
And the answer is yes, absolutely. And a lot of people sometimes they're wondering, well, I'm not depressed. I don't have a mental illness. And so they don't say anything. You've again say something. Sometimes that depression or that anxious feeling is actually an early warning sign that there is a clot. So either side of the equation, please say something. I'm inviting my patients to tell me about their symptoms, both mentally and physically, all the time, because sometimes it's the body to the head and sometimes it's the head to the body. So, and again, the anxiety and the depression can be treated and can be relieved. And of course, if you've had an event that's very frightening to you, like a clot, chances are you're going to have some anxiety or depression afterwards. All right, so those were my questions that patients have asked of me. Those are my top questions, and those are the answers that I'm sharing with you tonight. So I'm hoping that you will have found something very useful in terms of what happens once you get home. And I know I heard and learned things from both Dr. Kadisha and Dr. Dietrich. So I'm going to turn it back over
Me
to our
too.
host for the evening, and let's see what we can wrap this up with.
Okay. Well, we got some comments here, and one is from the person who requested this topic that it be discussed, and that is Victoria. She's in the comments, and she shared her experience with having a DVT. She says, "Mine happened after my long drive from Canada to Pennsylvania. I was fortunate to suspect a DVT due to the three symptoms I was experiencing. I called my PCP and she told me to go right to the ER where they found four clots in both legs. I asked her what steps she is taking to prevent DVTs in the future, and she says she's on anticoagulants, 10 milligrams, and um, and baby aspirin daily, as well as wearing compression socks. So thank you,
Okay.
Victoria, for this topic and for sharing your experience.
Oh, great. Yes, thank you.
Thank you,
Yeah.
Victoria. Thank you.
This has really been great. I mean, we learned a lot about blood clots and the risk factors, the symptoms, and the diagnostic workup, as well as what happens in the hospital and what the final follow up is. Do y'all have any final words before we wrap it up for the night?
Yeah,
Mm-mm.
I'll just say, I with all that's been going on in the world, between, pandemic, economic crisis, political and racial crisis, a lot of things are coming up. I do see the anxiety and depression, but I want people to remember, take care of yourself. I'll use myself as an example. I had my COVID-19 workout. It also ties in because it puts me at risk for a clot. And I was getting out of my workout clothes and I slipped and fell and I fractured my foot. And I've also had patients, and I kind of waited to do to get the x-ray and to really drill down and do the diagnostics, hoping this was going to go away or feel better on its own. And of course, I was, using my own medical background and knowledge to deal with it. But so I know, knowing what I know, if I can hold back and then be reluctant to seek care for whatever reason. And right now we have a lot of reasons and a lot of distractions because, of course, this was actually right at the end of the lockdown. So you couldn't even get a foot x-ray, for example. But I'm encouraging people that have been putting off their care during this time and who have been a little reluctant. There's certain elective procedures that weren't going on. Please, tomorrow morning, pick up the phone, make the phone call, find out who's open. And if you've had to wait because of the lockdown, now that things are opening up, don't wait anymore. Make sure you get the treatment that you need and that you get taken care of sooner rather than later.
That's an excellent point. Excellent point. And I just wanted to ask or to add to the conversation as a patient, as a consumer, if you know there are some things that you can possibly do to help lower your risk, such as the immobility, smoking, that kind of thing, why not do it? I mean, so, you know, make your health your top priority. All right. So that was my final words.
Mm.
Hmm. Okay. They're good. All right. Well, thank y'all for joining us tonight. Please share this live stream with other people. Invite them to share. You please share. If you're watching it on the replay, put a replay in the chat. I am Dr. Dietrich Gorman. I am your board certified family practice physician. I'm a best-selling author, a speaker, and I am also known as America's Relaxation Doctor. And I help individuals who are stressed at work learn to live a more healthy, productive, and fulfilled life. You can follow me on all social media at Dr. Dietrich G. That's DrDeitRickG, or visit my website at drdietrichg.com. Thank you.
Mhm. And I'm Dr. Kadisha. I'm your board certified emergency medicine physician, sports medicine fellow, speaker, consultant, and author of the best-selling book, Help Us Help You in the Emergency Room. It's what an ER doctor would tell you if she only had the time. And I'm the creator of the mobile MD kit. Definitely follow me on Facebook and my Instagram account. I want to thank people. The support's really coming in. Follow me on Facebook and IG and Twitter at DrKadishamd.com is for my website, and just Dr. Kadisha MD for Facebook, Instagram, and Twitter.
Good.
Excellent. And I
Good,
am
good,
Dr. Carol Penn, doubly board certified in family medicine and in obesity medicine. I am also your master movement meditation and mindset coach, two-time best-selling author. In my book, Baby Meditation in a Time of Madness, a guidebook for talented tweens, teens, their parents, and guardians who need to thrive, was written exactly for a time such as we are living now and experiencing right now. Please join me every weekday morning at 6:45 a.m. to get your mind right with meditation on my Facebook live page. That's at Dr. Carol Penn, DrCarolPenn. Movement is my medicine. Will pop up. We're there every weekday morning at 6:45. It's 15 minutes to power up, level up, and get our minds right and go out and walk strong in our purpose.
Thank you, everybody. Please put in the chat what other topics you want us to go over in the future. We look forward to hearing your comments and your topic choices. Thank you so much, everybody. Have a great Sunday. Bye,
Bye,
y'all.
everybody.
Thank you.